Question period. I recognize the Leader of the Opposition.
Mr. Speaker, this tired and out-of-touch government is failing to deliver on the cost of living. Families in Saskatchewan are struggling more than anywhere else in the country. Yet this Sask Party government is offering no relief. Instead, we see them hiking taxes and fees at a time when families are struggling just to get by. Now, Mr. Speaker, we have a proposal to remove the fuel tax from gas and diesel for 6 months to give families the relief that they need. When will we see the Sask Party government finally act to offer some much-needed relief to families in this province?
Recognize the Deputy Premier.
Only too often, Mr. Speaker, we have to question what the members opposite say in their preamble, because sometimes the facts are much different. Right. She is well aware that Saskatchewan is the most affordable province in our country for a family of 4 when you take in taxes, housing, utilities, all into consideration, and there's many, many, many reports that back that up. She is also well aware that there's over $2 billion worth of affordability measures within our budget each and every time. But furthermore, just recently, we had announced that we are not going to collect the carbon tax, the Jagmeet Singh Trudeau carbon tax, on home heating fuel. That is worth more to families in our province than what she is suggesting.
Right. Recognize the Leader of the Opposition.
Mr. Speaker, apparently the minister wants to deny the reality of people in this province as they report it. But this is a government, that finance minister, is so completely out of touch with the realities of people in this province. Now, Mr. Speaker, reminded that this is the same finance minister who had no regrets about an $8,000 flight for a trip to North Battleford for lunch. And it's clear, it's so clear that she still doesn't understand the realities that families are facing. Mr. Speaker, read the room. People in this province need a break, and they're looking to this government for help. Why won't the Sask Party finally deliver some cost of living relief, and why won't they give families a much-needed break at the pumps?
Recognize the Deputy Premier.
Mr. Speaker, each and every budget, we give individuals and families within our province a break right within their personal income tax. We not only have the lowest personal income tax in the country, but it's indexed to help cushion it against inflationary pressures. But she says, why won't we do something? We have just recently announced what we're going to do. We are not going to collect the carbon tax on home heating fuel, be it natural gas or electricity. That is something, and it's worth more, quite frankly, to those people who have to heat their homes, and it gets cold in Saskatchewan winters, than what she is suggesting in the fuel tax.
Recognize the Leader of the Opposition.
Mr. Speaker, this tired and out-of-touch government is failing on the cost of living, and they're failing when it comes to health care. And, Mr. Speaker, nowhere is that more clear than when it comes to mammograms and breast cancer care. Now, after refusing to listen to health care workers and after performing 10,000 fewer scans per year in the public system, this government is now sending women out of the province for care that they should be able to get here at home. Mr. Speaker, it shouldn't have to be this way. Why did the Sask Party let things get so bad before they finally decided to act?
Recognize the Minister of Health.
Thank you, Mr. Speaker, and I want to begin by thanking all of our cancer teams of the Saskatchewan Cancer Agency in Regina and Saskatoon for the outstanding work that they are providing, treating people right across this province that are faced with cancer. Mr. Speaker, as we discussed well in this House last week, some of the investments made into this particular area when it comes to women's health and to options for diagnostics and treatment for breast cancer, Mr. Speaker, a number of initiatives that are both medium and long-term to address the vacancies priorities we have when it comes to the requirement for filling the vacancies for specialized breast radiologists, Mr. Speaker, but also the amending of a contract that the government currently has with a private provider, publicly delivered and publicly funded, I should say, Mr. Speaker, in Calgary, to provide an option for women to be able to travel there to accept some of the procedures that they need on a very urgent basis, Mr. Speaker. Contacts were being made after the announcement on Wednesday. People across this province were being contacted on Thursday and Friday, Mr. Speaker, and I can confirm for this House that a number of patients have already accepted that offer. It will be travelling to Calgary, Mr. Speaker.
Recognize the Leader of the Opposition.
Speaker, no kidding. People who are on an urgent wait list for a mammogram with a lump are taking him up on the offer, but as I said, it doesn't have to be this way. Now, Mr. Speaker, let's talk about this so-called solution from that government. Under his plan, we're paying a private company in Calgary $2 million for 1,000 scan. Mr. Speaker, that works out to $2,000 per scan. Now, what do those same scans cost here in Saskatchewan? $206.20. Why are we paying almost 10 times more, Mr. Speaker, for women to get scans in Calgary instead of building up the capacity to do these scans here at home?
Hear, hear.
Recognize the Minister of Health.
Thank you, Mr. Speaker. As indicated last week, this is a short-term solution to address the unacceptable wait time for scans, for biopsies for Saskatchewan women who are on the urgent and long waiting list, Mr. Speaker. In addition to this, though, as I've said before several times, Mr. Speaker, we are extending hours of service with additional volumes in Regina and Saskatoon. We're also looking to utilize existing capacity or expand capacity in regional sites across this province, Mr. Speaker, implementing 3D breast imaging and SHA facilities across the province, also centralizing the booking for breast imaging across Saskatchewan in order to improve the access for Saskatchewan women so they have quicker access for patients. Mr. Speaker, it appears that the members opposite would rather nickel and dime cancer patients across this province, would rather count those dollars and cents than get the women of Saskatchewan the care that they need on an urgent basis, Mr. Speaker.
Hear, hear.